I want to thank everyone for being here today. This is an exciting day. We're having this kickoff of our enrollment period. The kickoff is today, but the enrollment period, as you know, starts November the 1st through January 31st. I'm Charlita Tavares, the CEO of Primary One Health, and we are a system of 10 locations of a federally qualified health care center. We are very proud of our designation, and I want to note that we have our state association CEO, Randy Runyon, from the Ohio Association of Community Health Centers. We are very proud because we serve the uninsured, the underinsured, and those who are insured in our community. And that's why this enrollment period is so important, because we want to ensure that everyone has health insurance, that everyone has the care that they need, and we are proud to have a system of 10 sites that serve right now about 35,000 patients, which is very important. Part of what we do is work with certified application counselors. We have 4 of them with Primary One Health, Burhan and Brian and Arlene and Kendra, who are working with us to enroll individuals. And then when they're not serving as certified application counselors, they serve as community health workers, which we believe is very important in navigating our healthcare system. I am proud to stand here with all of the individuals who are behind me, beside me. They're all working together with us as a coalition to enroll as many Ohioans as possible, and certainly in Central Ohio, as many residents of our community as possible during this enrollment period. And I have the honor of introducing our U.S. Department of Health and Human Services Regional Director for Region 5, which Ohio is a member of, Kathleen Falk. And as you probably know, she's been with us on several occasions because she is our lead person for the U.S. Department of Health and Human Services on all of these issues. She works with our federally qualified health systems, our health departments, and I saw Dr. Teresa Long, who is our health commissioner. I also want to thank, before I bring Director Falk up, our Community Services Director, John Tolbert, because he works with the certified application counselors to do the outreach and the in-reach within our system to ensure that everyone has the services that they need, but more importantly, that they're covered by the appropriate insurance. So without further ado, I'd like to bring up our Regional Director, Kathleen Falk.
Thank you, Director Tavares, but she has many hats. She is also a fabulous state senator and has been with us from the get-go. But I want to first acknowledge and thank everybody here for being with us from the get-go. Councilwoman Tyson, from the very beginning, has stood up proudly to help launch this effort. Senator Brown has just voted so many times to keep the Affordable Care Act. Thank you to Senator Brown for all he has done. We are so privileged to have Commissioner Brooks, who has been there from the very beginning, Representative Craig, and Senator Tavares, again, right from the very beginning. They have provided their leadership here. I also want to thank Mayor Coleman and Public Health Commissioner Dr. Teresa Long for being here from the start. But I also especially want to thank all of you, our partners here, who have made this all happen. The Ohio Association of Food Banks and all the umbrellas, the umbrella of all the groups, so within that, Enroll America, the City Health Department, thank you all for all you have done, because collectively now, together, we can stand and look each other in the eye and say, 17.6 million more people have health insurance today than did You have made that happen. You have made the difference right here in this county with an increase in Medicaid expansion that you worked hard for and are enrolling people, and then another 26,000 people in the marketplace this last round. Now, because we know you are really smart, really hardworking, we're making the job even harder this time. My boss, the President and Secretary Burwell, said that we were going to try to reach 10 million people by the end of 2016. Are we up for doing that?
Yes.
Yeah. I know we can do it. We know something about who's remaining uninsured. We know more than we did a couple years ago. And here are some of the statistics and challenges, but I know that we'll know how to find them. We know that about half, almost half, are between 18 and 34. We know that more male than female remain to be uninsured. We know that about 7 out of 10 are working. They're working hard, but they are barely making it. We know that 4 out of 10 are making between 139 and 250% of the federal poverty level. And let me translate that. That's 30 to 60,000 a year for a family of 4. They're working hard. They are barely making it. We also know that they value insurance. We don't have to convince them that health insurance is important. They value it. They're worried about affording it. And that's where the good news comes in, because 8 out of 10 of the remaining uninsured are eligible for the financial help in cost credits and tax credits and cost sharing that is available. And that is indeed good news. But we also have even better news. Just fresh yesterday, brand new news here about the insurance premium rates for this open enrollment period. Now nationwide, they're going to go up by about 7.5%. You know, that's much lower than in the days before the Affordable Care Act. But here in Ohio, the news is really incredible. That on an average, they're going to go down by 0.7%. For all those hardworking, uninsured who want insurance, this is really good news. And I know this is the room full of people that are going to go out there and reach them and help them enroll. We have lots of exciting opportunities coming up, and a few people behind me are going to talk about them. But Souls to Enroll on Sunday is the great place to start. So I want to thank those churches and those organizers for stepping up and kicking us off. But I want to conclude again by just a profound, heartfelt thank you to the leaders here, to all of you leaders here, for what you are doing to make a difference in this community. The thousands and thousands of people who now will be able to sleep at night knowing that they get the preventive care to keep them healthy, but if something does happen, that they've got great places to go to, right like this clinic here at Primary One Health, but clinics all across this community. So thank you so very much for what you're doing, and let's go get another 10 million people. Thank you.
So yeah, I'm Joe Gilligan from, I'm the Central Ohio Regional Director for U.S. Senator Sherrod Brown, and he can't be here today because he's got votes in Washington, D.C., but he did want me to read a letter for everybody for the occasion, and I'd be remiss. Senator Brown has some great partners, and not many better than Congresswoman Beatty, and he's got some, Congressman Beatty has some representatives here today, Matt Cowpich, and some others here, so. Just wanted to give them a shout out as well. So the health law, or the Affordable Care Act, is the most significant reform to our nation's health care system since Medicare's creation in 1965. It ends insurance coverage denials for those with pre-existing conditions, unjustifiable premium rate hikes, and caps on annual and lifetime insurance coverage limits. Before the health law, children and adults could be denied coverage due to a pre-existing condition like asthma or diabetes. Seniors paid more out of pocket for drugs because of the so-called donut hole. Insurance companies could spend the majority of their money on advertising and executive salaries, and very few consumer protections existed in the insurance market. Today, the benefits of the health law can be seen across the state in the faces of millions of newly enrolled individuals through the health insurance marketplace and in our state's expanded Medicaid program. The health law has given millions access to affordable health care, some for the first time in their lives. Now, more families have the peace of mind that they won't go bankrupt due to lack of health insurance. Community health centers, which are key access points all across the state, are able to serve and thrive thanks to grants from the healthcare law. And preventive care and wellness exams are free, preventing costly ER visits as a form of primary care. The success of the health law rests on Ohioans having the tools and information they need to enroll. That's why today's event and the events this weekend are so important. You are on the front lines of helping get Ohioans the health insurance they need to afford care. Your jobs are not easy, especially with misguided attacks on the health law and misinformation about its benefits. My office is here to support your efforts in any way possible. Please don't hesitate to reach out to my staff during open enrollment and year-round. Thank you to everybody here. Sincerely, U.S. Senator Sherrod Brown. Thank you.
Good morning. Good morning. Let me certainly thank you for the privilege of being here this morning. I don't know if there's any more single issue more important than health care. Tomorrow, Senator Tavares and I will be at an infant mortality commission meeting. And we have talked about that issue. I know that we've had the opportunity to talk about the statistics around people that are suffering. But the reality is they are people. There are faces in our community, our children and our families. And in the state legislature with the Medicaid expansion and the implications of that, what that meant for the state of Ohio, hundreds of thousands of families have been helped, where there's been a safety net for them. This has been the safety net. But yet there's 500 to 800,000 people that are yet to be involved in this process in a meaningful way. And so today it's not about hyperbole. The fact of the matter is all of our families, there is no accident that we're here at the John Maloney Center, right here in the heart of the south side of Columbus, where so many families are being impacted. And with the opening of the Reed Center, that will have a significant impact on the lives of families and children from very early ages until opportunities for work. And so this issue around health is vital. It's one that we all need to be involved in. It will have serious implications not only for our children, but for our children's children. And so I'm honored, deeply honored, to be with Councilmember Tyson and many others around this assembly and all of you as we look at tackling this extremely important issue. God bless you and have a great day.
Well, good morning. First of all, thank you all for coming out on this rainy day. But you know, this is nothing compared to what we've been through trying to get this Health Care Act passed and everybody enrolled, right? So give yourselves a round of applause. We're here. And it's so exciting to see this unfold. In 2009, the county commissioners began grappling with infant mortality, with better birth outcomes. We stood at Nationwide Children's Hospital and announced a $9 million grant that has led to saving thousands of little babies' lives, and I'm so proud of that. And now the Infant Mortality Task Force has taken that to the next level. Not one child in this community should die because they don't have health care. So I know all of you recognize, too, that we've been struggling for many years with the scourge of domestic violence. And do you know, back when I was in the Ohio Attorney General's office, we began the march towards good laws to help women, primarily women, get out of those terrible situations. And so many of those women around the state of Ohio could not get health care coverage, so they and their children would stay in those awful, awful situations. Now, guess what? They don't have to stay anymore. They can get out of those situations and get their family into a new life. And thank you very much, all of you, for every bit of work that you have done. And thank you, President Obama, for having the foresight and the courage to make certain this happen. And it's so wonderful to see you here today. I know we're going to be north, south, east, west over the next several days, signing people up. So let's talk about that issue with domestic violence. Let women and their children know they no longer have to stay in that unsafe environment. They can get out, they can get health insurance, and thank you all for being here today and helping our women and children in this community.
Well, thank you and good morning. And so this is Domestic Awareness Month, the month of October, so it's really so appropriate for Commissioner Brooks to be able to share the importance of domestic domestic violence awareness and to make sure that women have the opportunity to have health care for their children. It really is an honor and a privilege to stand before you today. And just because I care so deeply about health care is a basic right that each and every person should have. And so with President Obama, certainly with all the representatives that supported health care reform, the Affordable Care Act, we're so privileged and so proud. We're also thankful that our governor also made sure that we had Medicaid expansion to be able to ensure that more individuals in Ohio would have the opportunity to be able to have health care. Today we stand in a fabulous facility, and this facility is with the president of Primary One. We are so thankful that President Tavares, I want to call her other title, but President Tavares and her team of individuals in this room, John Tolbert and others, are here that are ensuring that individuals have the opportunity. They're going out and finding individuals in the community as well as individuals coming to these wonderful facilities, that they are making sure they're signing them up for the health care benefits that each and every one of them deserve. I also want to recognize someone in the room from Columbus that plays a tremendous role in health care and ensuring that everyone has an opportunity to have health care. From Public Health is Dr. Teresa Long. Just thank her for what she does. Certainly on the federal level, besides our congressional leaders, I had to thank our regional director from HHS, and that's Ms. Kathleen Falk. She spoke earlier, but she has been instrumental in ensuring that our region receives dollars to be able to support the work that we do, but also she is certainly a champion, as you heard her speak, for ensuring that each and every one that we're out here doing the work that we can do to get those 10 million people to be able to get health care by the end of this enrollment period. So I'm very happy to be here because it is so important. We know that there's still many, many individuals in this community, as well in the state of Ohio, that don't have health care insurance. I think the Kaiser Foundation just had a report that just came out recently that said about 800,000 individuals in Ohio don't have health care insurance. Of those 800,000 individuals, there's about half of them that would be eligible for Medicaid. About 100,000 of them also, 165,000 I think, would be available to have tax credits. That's a lot of individuals that we know are waiting and just need to be able to hear this information. They need to be able to work with our healthcare navigators, our healthcare workers, to help them to be able to enroll. So I wanted to come by and just say this is so important for the residents of the city of Columbus. We need our residents to be healthy so that they can then live a healthy and a quality great life for their families. Again, thank you for all the partners that are in this room that are making it happen. There's a couple of events that I want to just quickly mention. If you want to hear more about the events, I'm going to ask you to either go to getcoveredamerica.org/connector, getcoveredamerica.org/connector. Also, to find out more information about healthcare insurance, go to www.HealthCare.Gov. And then this week, November the 11th, from 5 to 8, there's going to be Obamacare Jams, and it will be at East High School and from 5 to 8 p.m. And so the East High School band will be there performing, but please come out and learn more and enroll in for free or low cost Medicaid medical insurance plan. So come out, Obamacare's Jams. Thank you. And now I now want to introduce someone who has certainly certainly has utilized the Affordable Care Act, Ms. Jacqueline Neal, not Kathleen, Jacqueline Neal. Thank you.
Hi, good morning. I'm really pleased to be here. Thank you so much for inviting me to be a part of this. I have always worked, but I've been a consultant for the last several years, so my income is, sketchy. It's up and down. And it was through an insurance broker that I figured out that I qualified to get health care under the Affordable Health Care Act. So my premiums, total out of pocket every month, premiums plus my prescriptions, I had really bad asthma and allergies, were over $400, which is an insane amount of money, as you can understand, especially for someone whose cash flow is now compromised. So that didn't make any sense. So through the exchange, I qualified, and I was able to get my premiums down to $124. Even better, because of InHealth's program to cover you. If you go through, they have a program for asthma. If you go through the study, they pay for your prescription. So I pay nothing every month for my prescriptions. Nothing. So that has been an incredible blessing. I have parents who are getting older. We all know that. We're all helping out and trying to give back and help them stay on their feet because they're living on Social Security. So it has been a true blessing. So I am grateful for this program, grateful to President Obama and to my insurance broker. Thank you.
I want to thank everyone once again, and I have a couple people I do want to introduce. Nita Carter with UCAN, Ohio, and certainly Lisa Hamler-Fugit with the Second Harvest Food Banks, and then Enroll America, all of the staff with Enroll America who are here today, Mr. Keck and others. We thank you for helping to pull us together to get this kickoff started and to do our very best to make sure that we enroll everyone who is eligible for any one of the insurance plans within Central Ohio. Because we know without health care, our children aren't going to be ready to learn and our adults are going to be ready to earn. So we appreciate all that the navigators, the certified application counselors, and all the partner organizations are doing to help us. And with that, we will conclude today's press conference. Thank you very much.